Hi, I'm Dr. Henele with Genesis Health Systems, and I'm here to talk with you a little bit about release point therapy. I want to give practitioners of release point therapy some hand and forearm strengthening exercises that are really fantastic for allowing you to have the hand strength necessary to affect the superficial fascial expansion holds. One of the problems that therapists have in this system, especially young therapists, when they're just learning it, is that they say, oh, my hands, they just don't feel strong enough. Well, that's very true. There's a few muscles that we have to get strong in the hands so that you can hold the techniques basically indefinitely and with little force. What you find is that if your hands aren't strong enough, you're going to do the technique, they're going to fatigue, and then your body will start shaking a little bit because you don't have the physical strength necessary to affect the change over the person's soft tissues, the fascia. So a couple things we want to look at. We have a few muscles that are of great importance, and you might be asking yourself, why am I holding a bat? I'm going to show you in a few minutes. But what I want you to see is come up a little bit closer. There's two muscles that we really have to focus on. One is the Flexor Carpi Ulnaris. So you can do this exercise where you can make a fist and you'll see some tendons come prominent. One of the tendons right here is a Flexor Carpi Ulnaris, and mine actually isn't as strong. There it is, as it typically is, because I've been on break for a couple months from doing a lot of body work. But when I start my season up again, like I'm starting now, I have to get back into my bat exercises. And one of these exercises is designed to strengthen this muscle up. This muscle originates off of the medial epicondyle of the humerus and inserts on the pisiform bone here. What you'll find is that in practitioners who develop a lot of wrist injuries, hand injuries, and so forth, this muscle will be atrophied. They'll make a fist and you won't even see that tendon at all. Right there, you can kind of see it right there. If you can't see that tendon, or when you press into it, it's very weak, what's happening is that scar tissue that I can accumulate here in the carpal tunnel and in the palmar aponeurosis will begin to compress the carpal tunnel, and it can begin to pinch off the median nerve. So these bat exercises are fantastic for practitioners to keep their hands strong, but they're also fantastic for people dealing with carpal tunnel. Now, I know you just walked away, don't leave just yet, come on back in. What we want to do is look at some of these muscles here, the Adductor Pollicis. And this is a muscle right here that a release point therapist will develop a lot of hand strength in through the bat exercises, and also in through actually just doing the technique. And there you can see how big that muscle can and should get. And again, check back in with me in a couple months, this muscle will be even stronger. The stronger this muscle is, the stronger that this muscle is, the more likelihood that your carpal tunnel is going to stay open so you don't develop wrist injuries, and you're going to be able to affect a fascial hold on a person's tissue with minimal force, which is what we're always after. Work smarter, not harder. Okay, so go ahead and back out a little bit. I'm going to show you a few of these exercises. About right there might be good. What we're going to do here is first get a good bat. You can use golf clubs, but I like the bat because the handle has a little bit better width to it. You're going to find a place on the bat where you can affect the hold like this. Put the bat in your palm and bring your forefingers to the heel of your hand, but your thumb stays extended out. With this hold here, what that does is it stretches open the carpal tunnel, it stretches open the palmar aponeurosis, but it also starts to develop that adductor pollicis muscle as well as the flexor carpi ulnaris. Let's see how. So we're holding the bat here. This is a good, comfortable position for me. If the bat that you have is too heavy, you can come down on the bat a little bit. If you want to start progressing and getting that muscle stronger, you just start moving up, and eventually maybe you get a heavier bat. But this is a good size bat here for us. I have a good hold on the bat. I want to keep my elbow on the body, and then I want to take my offhand and act like a brace, kind of push down a little bit so this arm can push up and engage the bicep. First thing we do here is just simple wrist flexing exercises, lateral flexion of the wrist. And it's that easy. Every time I do this, my middle finger is actually touching the flexor carpi ulnaris, so I can feel it contracting each time. My left hand is stabilizing this motion. And I can do this exercise with the good bat control, good bat speed, 1, 2, 3. I can do this up to counts of 100. So we'll do 100 of these, boom, boom, boom. You don't want to see me do 100, so I won't. But anyway, you get the idea. Then we go to the other side, same thing. Get a good hold on the bat, 4 fingers to the heel of the hand. The thumb is flat. Open up all of this carpal tunnel here. Elbow on the body. Other hand supporting and cross fiber. That's the wrong word, isn't it? Yeah, it's not cross fiber. Flex. Flex the bat, flex the bat. My mind is on other things, clearly. And just keep flexing, flexing, flexing. And what you'll notice over the course of 2 weeks, this muscle gets very strong, Flexor Carpi Ulnaris. This muscle right here, the Adductor Pollicis, gets very strong as well. Now, that's a great exercise right there. If you just do 100 of those each day, you're going to feel fantastic. Your hands are going to get super strong. Let me show you one more for those of you who want to do a little bit more. The hold is exactly the same, but now we're going to get into the supinators of the body. Stabilize the arm, and now it's very simple. All you do is rotate, supinate, and bring the bat up just like that. And these you can do again 100, you can do 75, you can do 60. But what I found over the years of working with carpal tunnel patients is that doing these 2 exercises are essential to keeping the carpal tunnel open, to healing the carpal tunnel up so that we can get people out of pain syndromes. And they also just happen to function as a great builder of muscles for practitioners. So try those out. Keep your forearms and your hands open and strong, and find out what it can do for you in application of release point therapy. Thank you.